Second white coat. Subscribe and like. Let's learn medicine together.
All right, welcome. Today, we are going to play detective. We're cracking open a fascinating medical mystery that can literally turn a person's world completely upside down. We're going to unspin the terrifying condition known as vertigo, and by the end of this, you'll see exactly how doctors solve this puzzle one clue at a time.
Just try to imagine this for a second. One moment, you're totally fine, and the next, bam! The entire world just erupts into a violent spinning chaos around you. It's this overwhelming feeling of motion when you know you're standing still. And this isn't just feeling a little dizzy. Oh no, it's a total, terrifying loss of control.
So, what on earth is going on here? What system, inside our own bodies, a system we depend on every single second of the day, can glitch so badly that it completely shatters our sense of reality? That's the big question we're going to get to the bottom of today. To solve this, we're going to follow a real case. It's about a 32-year-old woman, and her story is just a classic example of this whole medical puzzle. She has these recurring, absolutely debilitating episodes that just hijack her life for hours on end.
So here are the facts of the case. 5 times in just the last year, her world has been thrown into complete chaos. It's not just the room-spinning feeling, the vertigo. It comes with this severe, uncontrollable vomiting. Her balance is so shot she literally cannot walk. And then, after a few hours, it all just vanishes, as if it never happened.
Now here's where it gets really interesting. The most important clues in a case like this, they're not found during the attack. Nope. The key to solving this whole mystery is looking at what we find when all the symptoms are completely gone. This is where the real detective work kicks in.
And this is our central clue. During an attack, she is just completely incapacitated. But in between these episodes, she feels perfectly fine. Her physical exam is totally 100% normal. Now that contrast, that's not a dead end. That is the single biggest hint we have, and it's pointing us away from some suspects and right toward the real source. Okay, so one of the key tests doctors do is called the Romberg test. It's designed to check your body's own sense of position, what doctors call proprioception. It's basically testing those nerve pathways that tell your brain where your feet are, even when you can't see them. Another huge one is the tandem gait test. You know this one. It's the classic, walk a straight line, heel to toe. And it's not just for sobriety checks. It is an incredibly sensitive way to find problems in the specific part of the brain that handles all of our coordination. And get this, here's the twist. She passes both tests with flying colors. Her Romberg is normal, her tandem gait is perfect. So wait a minute, how can someone who loses their balance so badly that they can't even walk during an attack have perfectly normal coordination tests when they're feeling okay? The plot definitely thickens. Okay, so with these clues in our back pocket, we can now do what all good detectives do. We can start ruling out the usual suspects. This whole process of elimination is exactly how we're going to find our culprit. All right, suspect number 1, the cerebellum. Think of it as the brain's master coordination center. If something goes wrong here, you can get something called ataxia, which is basically a lack of smooth voluntary movement. It's always a prime suspect for anyone who has trouble walking. But we can rule it out. And why is that? Because her tandem gait is normal. Remember, that heel-to-toe test is super sensitive for cerebellar problems. If that were the source of the issue, we'd expect to see some lingering trouble with that walk, even between attacks. But we don't. So the cerebellum is officially off the hook. Okay, on to suspect number 2. These are a set of nerve pathways in your spinal cord called the posterior columns. You can think of them as the information highways for proprioception, that sense of where your body is in space. If these are damaged, you get really unsteady, especially when you can't use your eyes to help you balance. And again, we can cross this one right off the list too. Her normal Romberg test tells us that those proprioception pathways are working just fine. She can stand perfectly still with her eyes closed, which means those crucial nerve signals are getting through. So, the big takeaway here is, the problem isn't in her brain's coordination center, and it's not in the nerve signals carrying signals from our body. So if the brain and the major nerve pathways are clear, well, our investigation leads us to a tiny, incredibly complex, and unbelievably powerful structure hidden deep inside the skull, the inner ear. See, tucked away in your inner ear is something called the vestibular system, and it basically acts like your body's own personal gyroscope. It's got these little semicircular canals that sense when you turn or rotate your head, and then other parts, the utricle and saccule, that detect when you're moving in a straight line, like going up in an elevator, and also sense the constant pull of gravity. So what happens when this finely tuned system has a glitch? Well, imagine your brain's GPS is suddenly being fed totally conflicting data. Your eyes are telling your brain, hey, we're standing still, but your inner ears are screaming, no, we are spinning violently. Your brain can't make sense of that conflict, so it creates a false but overwhelmingly real sensation of motion. That feeling, that is vertigo.
And this sensory chaos, it doesn't stop there. That intense mismatch of information just floods other parts of the brain. It hits the brain's vomiting centers, which is why you get the terrible nausea, and it completely short-circuits the postural reflexes you need to just stand up straight and walk. So this one tiny glitch, it explains every single one of our patients' symptoms.
Okay, now that we've solved the case, let's boil this entire investigation down to a simple, really memorable takeaway. Think of it as a little framework you can use to make sense of the different kinds of dizziness.
Here it is. It's a simple 3-step rule. Step 1, if the main thing is a room-spinning sensation plus vomiting, you gotta think inner ear, the vestibular system. Step 2, if someone is really only unsteady when they close their eyes, that points to a problem with the nerves, the posterior columns. And step 3, if someone just can't walk that heel-to-toe line, even with their eyes wide open, that's a big red flag for the brain's coordination center, the cerebellum. And you know, that really brings us to a final thought. Our ability to just stand still in what feels like a stable world relies on this constant, invisible symphony of signals happening inside of us. And if a tiny little glitch in our internal gyroscope can cause such profound chaos, it really makes you wonder, doesn't it? What other hidden systems are working perfectly, right now, just to keep our reality from spinning apart?